Overview. What is laparoscopy? Laparoscopy is a type of diagnostic surgical procedure that your healthcare provider can use to look inside your body at your abdominal and reproductive organs. This procedure can also be used to collect samples of tissue, biopsies, for testing. A laparoscope, a thin tube similar to a telescope, is passed through a small incision, cut, in your abdomen. Using the laparoscope, your provider can look directly at the outside of your uterus, ovaries, fallopian tubes, liver, pancreas, gallbladder, spleen, stomach. Your provider might recommend a laparoscopy if other diagnostic tests, ultrasound and X-ray, cannot confirm the cause of a condition. Your provider might use laparoscopy to examine a tissue mass, confirm endometriosis or pelvic inflammatory disease, look for blockage of the fallopian tubes or for other causes of infertility. How do I prepare for a laparoscopy? Please follow these guidelines before coming to the hospital for your laparoscopy. Do not eat, drink, including water, or smoke after midnight the day before your surgery. Wear low-heeled shoes the day of surgery. You might be drowsy from the anesthesia and unsteady on your feet. Do not wear jewelry. Wedding rings may be worn. You will have some abdominal tenderness and cramping after surgery. Remove any nail polish before surgery. What tests are typically done before a laparoscopy? Your healthcare provider might need to do a few tests and gather some medical information about your health before your laparoscopy. This information can include previous X-rays from another facility, film reports, lab work, operative report, pathology report, cytology slides, tissue specimens. Your healthcare provider may also order additional tests, including ultrasound, computed tomography, CT, magnetic resonance imaging, MRI. How is a laparoscopy performed? A laparoscopy is done while you're lying down in a slightly tilted position, with your head lower than your feet. You'll be given a general anesthetic to relax your muscles and prevent pain during surgery. Next, a small incision is made near the navel. The laparoscope is inserted through this incision. Your abdomen is inflated to make the organs easier to view. The laparoscope might also be equipped with surgical devices for taking tissue samples or removing scar tissue. Your provider might also make a second incision at the pubic hairline. This incision provides an additional opening for instruments needed for completing minor surgical procedures. After surgery, you'll usually stay in a recovery room for about 1 hour. Then you will be taken to an outpatient surgery unit for continued observation. You will be discharged after you receive instructions for your home recovery. In most cases, you can leave the hospital about 4 hours after laparoscopy. It's rare that a patient will need to stay in the hospital overnight after this procedure. You'll be asked to return to your healthcare provider's office for follow-up appointments within 2 to 8 weeks of your laparoscopy. Please confirm your follow-up appointment schedule with your provider before leaving the hospital. One important thing to note before going in for surgery is that you won't be able to drive for 24 hours after surgery. Make sure you have someone available to pick you and stay with you for those first 24 hours. What happens after a laparoscopy? In most cases, you can go home not long after your laparoscopy. You'll need to wait until your anesthesia has worn off and your healthcare provider has made sure you aren't experiencing any side effects from the procedure. In the days following your laparoscopy, you will recover at home. How do I recover at home from a laparoscopy? While you're recovering at home after your laparoscopy, it's good to keep a few things in mind. These tips include: don't drink alcohol or drive for at least 24 hours after surgery. You can bathe any time after surgery. You can remove the bandage the morning after the surgery. Steri strips, which look like tape, can be removed 2 to 3 days after surgery. You can typically return to work 3 days after surgery. If you need a doctor's letter excusing you from work, please request one at your pre-operative appointment. Do not be concerned if your urine is green. A blue dye might have been used to check if your fallopian tubes are open. Are there any uncomfortable feelings I might experience after a laparoscopy? Just like with many surgeries, you might experience some discomfort after a laparoscopy. These discomforts can include: your abdomen might be swollen for several days after the surgery. You may take acetaminophen to relieve pain. You might have a sore throat for a few days. Try using a throat lozenge. You might have mild nausea. Try eating a light evening meal the day of surgery. Tea, soup, toast, gelatin or crackers might help relieve your nausea. Gas in the abdomen might cause discomfort in the neck, shoulders and chest for 24 to 72 hours after surgery. Try taking a warm shower, using a heating pad or walking. Can I expect vaginal bleeding after a laparoscopy? It's normal to experience vaginal bleeding up to 1 month after laparoscopy. Many women do not have their next normal menstrual cycle for 4 to 6 weeks after surgery. When your normal cycle returns, you might notice heavier bleeding and more discomfort than usual. Wait 2 to 3 menstrual cycles before determining if laparoscopy has helped to relieve your condition. When can I resume sexual activity after laparoscopy? However, pregnancy can still happen during recovery. If you wish to prevent pregnancy, make sure to use a contraceptive.